Longfellow.
That's right, doctor. I'm
Yeah.
Morty.
All right. How would you like me to call you?
Morty is fine, doctor.
Okay, Morty, can you please confirm your age for me?
I'm 55.
Okay, Morty, I can see from my notes that you have made an appointment to see me with some swelling. Is that correct?
Yes, doctor. I've been having this swelling in my face, and I'm a little worried about this.
Oh, I see. Can you tell me a little bit more about it, please?
Yeah, sure. It actually started on my lips, and it started going to my face. And
Mm.
yeah, it started a few hours ago. Yeah, yeah, I
Okay,
don't know what it is.
right. So you said it started a few hours ago. Apart from the lips, where else is swollen at the moment?
Just that, doctor. Nowhere else.
Okay, right. Morty, do you have any known allergies?
No, doctor. I mean,
Mm.
nothing that I know so far. What
Okay,
allergy?
all right. Have you had any similar swellings in the past?
No, doctor.
Okay. So before this started, can you think of anything that may have triggered it? Like anything? Did you eat anything or had any medications?
I mean, nothing out of the ordinary.
Hmm.
I ate I ate the food that I usually do. So, and
Okay.
things that I usually do. I mean, there's
All
nothing
right.
out of the ordinary that
Mm-hmm.
I can.
Okay. And by any chance, did you have any insect, any bites from an insect or something like that?
I don't think so, doctor. I've been at
Mm-hmm.
home the whole time.
Okay. And is the swelling painful?
No, doctor, it's not painful,
Mm-hmm.
but it feels a little tight and sort of tingly.
Okay. Is it itchy?
Not itchy
Mm-hmm.
really. Yeah.
Okay, right. Okay. Do you have any difficulty in breathing or any swallowing problems?
No, I
Oh,
don't.
okay. So, okay. Um, do you have any rashes anywhere else in the body?
No, doctor.
Mhm.
Just this.
Okay. And do you feel like you're dizzy or any faintishness?
No, nothing like that.
Okay. So, Monty, do you have any long-term medical problems?
Yes, I have high blood pressure.
Oh, okay. Do you know which medications you're on?
I take this medication called Ramipril in the morning.
Hmm. All right. So, how long have you been taking this Ramipril?
I would say a few weeks now.
A few weeks. Okay. Did you change the dose recently?
No, doctor.
Okay. So you've been taking this for a few weeks. That means you were recently diagnosed with high blood pressure. Is that correct?
Yeah, that's right.
Okay. All right. Um, Anything else? Any medications? Any other medications you're on?
No, just this. I try to maintain a healthy lifestyle. I eat,
Okay.
I
Right.
exercise.
Okay. Mm-hmm. All right. Do you have any allergies?
I mentioned that, doctor. Nothing that I
Yeah,
know.
you did. Yeah, sorry. Um, all right. What do you do for a living, Morty?
Oh, I just secured a new HR manager post
All right.
at
Mm-hmm.
Ask.
Okay. And I just ask a few questions about your lifestyle. Do you smoke?
No, I don't. I try to live a very healthy life, doctor. I don't
Okay.
smoke, and I very occasionally drink alcohol only when
All
there are
right.
work
Mm-hmm.
events.
That's all. That's really great. What do you think is going on, Morty? Do you have any ideas?
I have no idea, doctor. I mean, I was
Mhm.
suspecting it could be an allergy, but I'm not really allergic to anything. I mean, and
Yeah.
I didn't
Okay.
do anything out of the ordinary, so that's exactly what's
Mhm.
worrying me so much.
Yeah. Well, I see that you're quite worried. We'll see how we can sort this out. Other than that, do you have any concerns that you want me to know?
Yeah, I was wondering if you could, find out what this is, and
Mhm.
if I could be having any long-term health risks or problems.
Right. Yeah, definitely. I will help you with everything. Anything specifically you had in mind that I could do from this visit?
Well, I mean, I was hoping to find out what caused this and how to stop it from
Mhm.
happening.
Yeah, okay, yeah. Well, Morty, before we discuss that, I would like to examine you. I would like to take your blood pressure, pulse rate, respiratory rate, oxygen saturation in the blood, and do a rest of the general physical examination and a urine dipstick as well. Is that
Sure.
all right?
Yes.
Thank you. So, Morty, I have examined you, and it looks like your blood pressure is quite normal, and um, well, everything looks normal except that you have this swelling around your lips and face. Um, from what I have gathered so far, I think you're having a condition called
2 minutes
angioedema
remaining.
that is caused most probably by the blood pressure medication that you're taking, Ramipril. Would you like me to explain it a little bit more?
Yeah, I mean,
Yeah,
yeah, okay, what does that mean? Do I have to stop
yeah.
action?
Yeah, well, it's one of the side effects of Ramipril, but it doesn't happen to everyone. Like it depends on certain individuals, and in your case, you have developed this side effect. So we will have to stop the medication today itself, and we will when we stop the medication, the swelling will gradually subside, and we will have to change your blood pressure medication to another medication. Is that all right?
Okay, yeah, sure.
Yeah, yeah.
Do I
So,
have
if you
medicines
have,
for
sorry,
reducing? Should I be taking any medicines to reduce the swelling?
yeah. So, for the swelling, well, with time it will just go away. But if you have any discomfort or pain, you can take some paracetamol. You said you don't have any itching. Is that correct?
Yeah, there's no
Yeah.
itching at the throats, yeah.
So, actually, I don't have to do much. It will just subside with time. And this, it's not an aller. It's well, I would say a drug reaction. So it's not an allergy, but with with the change of medication, you'll be all right. Any other questions?
Yeah, that's great. Yeah, that's great to hear. So I can go home right now?
Well, I would like to change your medication. So, and then we'll have to go come back after about 2 weeks' time to for a review.
Move on
And
to the next station.
yeah.
Doctor, Dr. Albani, that was great. All right, so what
Thank
would
you.
you change it to?
Sorry.
What would you change it to?
Yeah, I couldn't tell it. So it's Ramipur. So I would change it to something like tell me Sartan or something.
Yeah, yeah,
AC.
you can change it to AC, ARBs.
ARDs,
That's
yeah.
usually the thing. Or you can also change it to, CCBs.
Yeah, okay, right.
Person is around 55.
Mm-hmm.
So another thing, recently we had a candidate, a doctor who actually asked this question, doesn't ARVs also cause angioedema?
Mm-hmm.
The answer is yes, ARVs do cause angioedema. But if you have already been seen to have, had angioedema from AC inhibitors, it's very unlikely that ARVs will be causing it, right?
Yeah.
So what exactly is this angioedema? Like, why does this happen? Any idea? And if it's a swelling, like, would you be giving, steroids, corticosteroids, or maybe add antihistamines to lower the swelling? Would you be doing that?
No, because it's not an allergy, but I'm not sure.
Right. That's a good. That's actually a good call. If you don't know, don't give unnecessarily. But in this case, even though there could be a suspicion of allergy, so usually empirically these medications are given. Some steroids or antihistamines are given, right? But this actually happens because AC inhibitors and ARBs, both of them actually interfere with the breakdown of a chemical called bradykinin. So bradykinin starts to accumulate in the bloodstreams, and they cause these reactions. So the offending agent is not antihistamine, it's in fact bradykinin. So you can't actually be giving antihistamine in order to lower them. So if you actually give antihistamine, it will not do anything, even though it is empirically given, especially in hospital settings, it's actually given, but it won't have any effect because it's not the chemical that needs to get lowered. All right. So there are certain, anti-bradykinin medications that are given, but they are very expensive, and sometimes, they might not even be available. So depending upon the availability, they may actually give that. Right? Does that make sense?
Yeah.
Awesome. Right. So what do you think? Is this an emergency?
No, he's stable.
All right. Yeah. So remember, whenever the swelling is in the face, you know, it is always an emergency. Right? Especially when a case with angioedema, what exactly happens is that, it doesn't show up immediately. Only after accumulation of bradykinin does it actually start to manifest. Do you understand? So the history will be a little more chronic rather than an acute history that you're expecting in an allergy. It will be a little more chronic. He had been using it, it would be weeks, months, or even years. Sometimes they actually present with the angioedema. All right. So, and the first attack usually progresses very fast, and it can, keep progressing. So he mentioned that it has been increasing. So you don't know whether it's going down because you haven't given any medication for it to go down. And since it's in the face, it can go deeper. So this is an emergency. So you have to admit them right away, and you have to keep them under monitoring. And if needed, you have to call in the ENT to intubate. So any reaction that actually involves the face, you are never going to take a risk with it, right? You are always going to, admit this patient. This patient actually will be getting admitted for like 1 to 2 days until the reaction comes down. You have to stop the medication immediately, warn him never to take this again, right? Because this will happen again if he takes the medication. All right. And tell him what will happen in the what will say A&E, where they'll observe him, regularly check his vitals, may have an IV access to give the medications, so they will be giving the antihistamine and steroids empirically, even though it won't have any reaction, but just in case, because at this point you don't really know. So just to be on the safer side, you'll actually be administering these medications, and then you will be waiting and watching. You'll be keeping them in the hospital for about a day or two. All right. And the other important question I want to ask. So what if it was an allergic reaction? Would you admit them?
Yeah.
All right. Why?
Um, the same reason because it's in the face and there's yeah, lip swelling.
Yes, yes. Absolutely, that's one of the reasons. The other reason when it comes to allergic reaction, there is something known as, all allergies have something called a biphasic reaction or biphasic reaction, meaning they have an initial manifestation and then they have a later manifestation. All right. So you have to be very careful even with allergic reactions. Even after you have administered medications to allergic reaction, you have to keep them for monitoring for at least, 6 hours. 4 to 6 hours of monitoring you have to maintain to check for any biphasic reaction. So any allergy also you will be monitoring. You'll be keeping them for observation. Okay, so in either cases, you have to observe them, especially because it's in the face. It can, track down. All right, let's quickly look at the marks. I think you did well in the first instant as well. Yeah, I would also say sometimes listening, you're kind of interrupting me. Try before I can finish, you start your sentences. So try to let me finish before you actually start your sentences. Otherwise, everything was pretty on point, I would say. All right, so let's quickly take a look. So patient full name and age, good job. open the history with a broad question. Can you tell me about what brought you in today? That was good, open questions always. Recognize the facial swelling and associated. I can understand this swelling must be very worrying, right? Elicit a detailed history of the swelling. Ask about the onset, progression, location, associated pain, triggers, and whether it has occurred before. So good job on that. And this is important. Assess for any red flags. Ask specifically about breathing difficulty, swallowing, hoarseness, dizziness, rash, or chest pain to rule out airway compromise or anaphylaxis. So if you're even thinking about the anaphylaxis, think about if there has been any breathing difficulty. You asked about the rash, dizziness. I think you covered most of the points. Yeah, that's pretty good. So inquire about known allergies, if he has any known drug or food allergies that might have contributed to this. So that's one thing that they will specifically keep saying, that I did not do anything out of the ordinary. It doesn't seem like, it could be anything. I'm not really allergic to anything. I don't understand why this is happening. Ask about current and recent medications, specifically confirm the use of ACE inhibitors like Ramipil, as they are common cause of angioedema. So as soon as you got the medication, you know what it was, right? So that was good. Screen for any relevant past medical history, including hypertension, asthma, autoimmune disorders, previous episodes of swelling, or hospital admission. Assess lifestyle factors, ask about smoking, alcohol intake, diet, and exercise, particularly relevant for hypertension management, right? Explore the symptoms and their impact on life. How is this affecting you? How has this been affecting you? Has this restricted you from doing anything, right? And definitely you can explore that. ICE, you deployed the ICE questions very well. Vitals, general physical examination, examination of the swelling, good job on that. Urine dipstick was also very good. Yeah, I would say, because it's ACE inhibitors, right? So you want to see if it's actually affected his kidneys at all. All right, explain the diagnosis of ACE inhibitor-induced angioedema. Name the diagnosis clearly. Based on what you've described, it seems you may have angioedema, likely triggered by the medication Ramipril. Explain the condition in layman terms. Angioedema means deep swelling under the skin, and one of the known causes is the medications like Ramipril used for blood pressure. Advise immediate discontinuation. This is important. Advice: you must stop taking Ramipril now. It's likely the cause for the swelling. Right? Explain the need for emergency assessment. Although your airway is not currently affected, this can change quickly. We'll admit you to A&E for monitoring, as this can get worse and may affect your airway, causing it difficult for you to breathe, right? And then list what happens in the A&E, including close airway observation, regular vitals check, IV access, and possible use of antihistamines and steroids, right? ACE inhibitor-induced angioedema is bradykinin mediated, which is non-allergic. So standard anaphylaxis treatment may not be effective, but it is given empirically, such as adrenaline, antihistamine, and steroids, to cover all causes until diagnosis is confirmed. Consider icatibant if available. This is the bradykinin, medication that is actually given to reduce the amount of bradykinin in the body. And discuss potential airway management. It's not important for you to remember the medication name. Just say that if there are any medications that we can give for, if it is available, then they'll give it. For this condition, if there are any medication that is available for this condition, then they will be giving it. Discuss potential airway management. Mention that ENT or anesthetics may intervene if breathing becomes compromised. That's important, right? Offer alternative treatment. We'll switch you to another antihypertensive, such as calcium channel blockers, that does not carry this risk. Never restart ACE inhibitors. That needs to be mentioned clearly to this patient, right? Follow-up, schedule a follow-up. You did set a follow-up, right? So I'm going to give you a yes for this. to see the response of the new antihypertensive medication and check for any recurrence of swelling, and clearly advise on when to seek further medical help during the transfer and while in hospitals. So even when you're in the hospital, even when you're traveling, when you feel that your the face is increasing in swelling, if you feel that your tongue is swelling, if your throat seems itchy, then, and which is making it harder to breathe, then seek immediate medical help. So the main thing that they'll do is they'll actually intubate the patient, because they can't give adrenaline like in normal cases. I mean, even if they do, it will not be that effective. All right, interpersonal skills demonstrate understanding and respect for the patient's feeling, acknowledge positive efforts in managing their condition, avoid jargon, and use layman terms to explain medical information, pause frequently to check for understanding and encourage questions, maintain, I'll give you a partial for this one, maintain a professional demeanor while being approachable and kind. All right.
Please like and subscribe to Turing Med School. Good luck with your preparation.